Hi, everyone. Thank you for joining us. I'm Dr. Anita Kumari. I'm a hematology oncologist in California, and this is the MD Survivor series, part two. I have Dr. Nidhi Gupta, who's the moderator as well with me. Thank you, Nidhi, for joining. And I have the panelists here, Dr. Brooke Weingarten and Dr. Shazuddin Faraz Muhammad. I'll let Nidhi take it from here. Thank you so much, Nidhi.
So thank you, our panelists today. We have Dr. Brooke Lipman Weingarten. She's an adolescent and child psychiatrist joining us from Michigan. And we have Dr. Faraz Muhammad, also currently a fellow as a child psychiatry, as I understand, please correct me, and joining us from New York. Both of you are survivors of COVID-19 very recently, and we really appreciate you taking the time today and joining us. Thank you. So, what we know about this virus is it has a bimodal phase. It's the initial viral sickness, which mostly is managed at home, especially if you don't have any high-risk comorbidities. And the symptoms are vague, as many people as I have talked to, you don't get the typical picture, especially in the first few days. And the biggest challenge is knowing, especially for healthcare workers who might have to go back and see some patients again. The biggest challenge is knowing whether I have it or not. So let me start with Dr. Weingarten. What was your challenge when you started seeing your symptoms in terms of diagnosis? You're on mute, I think. Dr. Weingarten.
There we go.
There you go.
I'm still muted.
There you go.
Okay, good. All right. So my experience was a little bit interesting because I was caretaking for my mother who was showing signs of COVID, and I was taking her repeatedly to different hospitals around the area to try to get her tested to see if that's actually what was going on. And we kept getting different, bronchitis and this and that, and you had to test for flu and RSV and other things. And so I was monitoring her when I started getting symptoms. I was, wearing a mask and gloves, and she was staying in my house in a separate room, but I started getting symptoms then. But I couldn't necessarily say for sure if I thought I had COVID, or because we haven't been able to get testing for her. So finally, we were able to get testing once I had to send her via EMS to the hospital. At that point, I had already reached out to other colleagues who then offered for me to come as a healthcare worker to get tested. And for me, that was, once we're seeing my mom escalate to that point, it got very real for me. And I felt that it was important to know for sure whether, either mine would come back first or hers would come back first, what exactly we were working with and how to manage this. So I went to a colleague's office, and they did a drive-by testing for me. And actually, the first time I had testing, it came back negative. And they called me, and my mom's test ended up that day coming back positive. And they said, we can guarantee you right now that this is a false negative. You have COVID. It had already been several days. I was, having fevers that have been constant, the body aches. I had significant nausea. I couldn't sit up for a very long time. I was getting very lightheaded. It was hard to take a deep breath. It sort of felt like a burning feeling. My mouth tasted metallic. I just was like tired and laying around, and I would watch my oxygen levels, and I was very afraid because I saw colleagues and I saw all kinds of things on the news and in the different groups that I participate in where, you might have mild symptoms and then they get very severe quite quickly. And that was really scary. And so I monitored that. And luckily things continue, I would say it lasted about 3 weeks and I felt pretty crummy. But my family was pretty amazing. Every day someone would drop something off at the porch, with food or something. People would drop stuff off for my daughter who was quarantined here with me as well. People were very supportive and checking in. And while I was exhausted and didn't want to look at my phone and talk to anybody, it was so nice to know that people were there and were worrying and were thinking about me and about my mom. And getting to that point was was really good until one day I sort of felt like I could take that deep breath again. And I'm actually planning to go next week to get the IgM antibodies, the blood test, because I want to know, what do I need to worry about? Can I go to the office at some point? Can I see patients? What do I need to be doing? So I'm sort of looking forward to seeing what comes from that.
And I'm looking forward for you as well. Must be a great feeling. So what you just mentioned in the earlier part of the sickness, while you were trying to analyze your symptoms and get a positive diagnosis, it poses a real big challenge for in real life, because sometimes you're multi-generational family. You
Right.
have parents, you have kids, you have extended family with comorbidities. And if you really, by the time you have symptoms, you've already exposed the rest of the family. And,
Right.
it becomes so tricky how much to quarantine, how much to social distance. Do I really have it? Because it's a really real life challenge to go through that. So can you walk us a little bit of how you went about making sure that, while you're getting tested, how did you protect your daughter, you said,
So that's a really good question. And I had to really think carefully about this. As a child psychiatrist, I was also considering, both physical and emotional health. And my daughter is 9 years old. So while she's quite self-sufficient, she's still a kid and she needs me to help her with things. And it's just the two of us here. And so she can't really be on her own, but she couldn't go elsewhere because she'd been exposed. And she was, quite frankly, she was pretty freaked out, and she didn't want to leave my side for the entirety of any of this because she was scared what was going to happen, and she was scared seeing my mother, and she was scared from the news. And so, to some extent, she really needed to be near me, and she was like an amazing trooper. We all had masks in the house. We all, nobody shared any drinks. Nobody, we did have gloves. We never left the house. I know my mom while she was still staying with us, we kept her in a separate room. When we were going in the room, we wore a mask. I was washing laundry more than I've ever done laundry in my entire life. That was an experience. But I didn't feel that we needed to quarantine. I've heard of some people where, someone would leave food outside the door and then they would run away and then someone else would get it. And some people did that, but I felt at that point that, my daughter was exposed. She was exposed to both me and my mother. And at that point, she never once showed any symptoms. I assume that she probably had it as well and was an asymptomatic carrier. But for her mental health and for her needing to be a child living in a home, I didn't shut her off from anyone, because where was she going to go?
Mm-hmm. Yeah, and that's a real life challenge for a lot of people also, because they don't have any extended family or friends where they could, leave their child. So did it ever occur to you to get her tested as well?
So I thought about it, but after I got tested myself, I felt that would be probably a traumatic experience for her. And knowing that my mother was positive and that I was positive, I just sort of assumed that she was as well. And she took to quarantine with me for the entirety of the time until after I was symptom free. And then we waited 2 extra weeks. And, she was, we both quarantined. We were in the house for about 5 weeks.
So in terms of your symptoms, you said you felt pretty crummy and you were, feeling fatigued and there's a whole spectrum of symptoms, and a lot of people complain of anosmia, sore throat, fatigue, and all that. What was the big, and I've also heard, we know that in some patients who are going to turn south, it's pretty rapid. The cytokine syndrome happens within 24 to 48 hours. And, typically we're advised to monitor pulse ox. And I've read stories where, people who are infected are, worried to death at night in terms of monitoring their pulse ox. Was that, how did you deal with that?
I felt better actually having the pulse ox at my house, monitoring. I did notice my heart rate. Certainly I had the tachycardia. My heart rate was high. And I was noticing at certain times, and more so at night, that my oxygen level would go down a little bit. Not terrible, but more like 93, 94.
Mm-hmm.
And then I would panic a little bit, which sort of spiraled things. But I think just monitoring, just knowing that I could check in and see, okay, like it's above 90, it's above 90, it's okay right now. And once you know, and with my mom, when I saw that hers went more under 90 into the mid 80s, then I knew something needed to happen. So I think just really monitoring your symptoms and making sure that your vital signs and your temperature and your oxygen level are above that 90.
And I think that, the psychological, what your psyche goes through, knowing that, knowing what you know about this illness and how rapidly it can decompensate, takes a toll on some people. And I would like to really tap into your knowledge, your background, as to what did you use? Was there a special technique or something that helped you stay calm through this whole period?
So that is a really excellent question, because I'm seeing so much more now. I think in the midst of everything, there was just sort of the panic, a little bit of, when you can't breathe the way that you normally do, it feels more panicky than other times. So there certainly is anxiety that comes along with that. There's the anxiety of being a caretaker and anxiety of worrying, there's all those kinds of things. I spoke with friends, I spoke with family. I tried to, I really was too tired to process a lot at that point. But I think the biggest part where the emotional and mental health component of things come in is almost afterwards. I found that afterwards I was having, panic dreams. I was having more emotional ups and downs. And at that point I felt, that's the time to reach out to a therapist. That's the time to talk to someone. And I actually spoke with a therapist during the time as well, because you're going through so many things. It's important to be able to process those feelings and to say, I'm feeling scared, and that's okay. And these are some things that I can do, talking to someone who's validating that it's okay to feel these things. Or sometimes even I would just sit outside and get a little fresh air, which was wonderfully helpful, especially because now it's starting to get nice out. But just to see that there are things happening outside in the world that is not just the terrible scariness that's happening inside of the house. But I don't think anyone should ever feel nervous about reaching out to a therapist or reaching out to a friend or family member, and making sure you have the support, because I think that this is scary. And I think during the time and after the time, because you get those vivid, weird dreams and just sort of all of the different trauma experiences that come from this.
Sounds good. Thank you so much. The last question, I do want to ask a lot of questions to Dr. Muhammad too. One last thing was, eventually, after your symptoms subsided, whatever, 2 to 3 weeks later, what was the point that helped you decide you can come off of sort of isolation at, social distancing at home or quarantine at home? Were you tested again, or was it just based on symptoms, or what was it?
So it was a combination of all of those things. I was told by other colleagues that at that point in time, some people said 3 days after your last fever, and then I've heard 3 days plus 2 weeks. And so to stay on the safe side, I did 3 days and then 2 weeks, and then I did actually get tested again, and that came back negative. And then I felt that at that point I was feeling enough like myself, and I had been quite a bit of time without symptoms, that it seemed to be okay. Not that we're really going anywhere now anyways, but that I didn't have to be isolated.
Can I quickly ask a question, Dr.?
Sure.
So just about the antibody testing, are you planning to get the antibody testing? And if that is positive, what are the steps for going for the convalescent plasma donation? Are you planning for that, if at all?
So I am planning to get the antibody testing this upcoming week, actually. I know in my area, I've been seeing a lot of different doctors in the area promoting that this upcoming week that, Michigan is now getting the antibody tests to provide that for people. When I called to set up the appointment, I was asked if I was sick and if I was tested. And I think at this point, those are the criteria to get the testing. They're not just checking antibodies with anybody, although it would be great if they could. Ideally, when that comes back, I think it'll be very interesting to see, what what it says. I know in Michigan right now, it's just the IgG testing, um, which gives us only like limited information, but it's better than not having it at all. And if I can donate plasma, you know, if that's something that I certainly would be happy to do so and open to help if we're, you know, if we can. I don't know a lot about the steps beyond that. It hasn't been advertised very much, at least in my area.
And the IgG testing that you're saying, is it through the government? Is it through your clinic? Is it through your personally paying for it? What is the situation?
So I'm going to actually, a colleague of family practice doctor is doing it. And I know several primary care physicians are doing it in the area. And they're working with a couple of the different labs in the area that are providing it.
So you're paying for it yourself, or the?
It'll be an office visit, so I guess we'll find out. I'm hoping that insurance will cover this, but we'll see.
So what is happening in California, in some places, they are offering some wellness clinics and all that, but they are charging like $250 for just that test. And we do not even know if that is like completely, you know, how specific it is, because it can cross-react with other coronavirus, like, you know, SARS.
Well, right. That, I mean, that's a problem because we don't know how specific it is. It's not a quantitative test. Exactly. So we don't know how long you have the antibodies for. We don't know how much. So it's not a perfect test, but it certainly is more information to gain at this point to understand more about this virus.
Yes, thank you so much.
All right, I think we would like to also hear from Dr. Mohammed. Are you on mute, Dr. Mohammed?
I'm on mute now.
Okay, all right. What was your biggest challenge in the first few weeks going through the illness at home? Whether it was related to any symptoms that was most difficult to deal with, or was it related to quarantine at home, you know, with extended family, or what was your biggest challenge?
So I guess my biggest challenge was I have two kids, 3.5 and 15 months. I think that was the biggest challenge because they didn't know why daddy is inside the room, why is his door locked, and why wouldn't he come to us and play with us? I think that was the biggest challenge. And the kids, especially my 3.5-year-old son, had you know, I would say had a huge impact. I still remember, you know, just today actually there was, you know, the TV was on and there was something coming on, COVID and coronavirus. So he cannot say coronavirus, he said coronavirus. So he was like, please turn that off. I don't want to hear about coronavirus. So I guess being more than the physical trauma I kind of had in that room for 2 weeks, it was a more of mental trauma. You know, especially my physical symptoms were more worse during the nighttime. A lot of body aches, you know, back pain, muscle pain, and actually, few days I actually woke up in the middle of the night crying because my back pain was so bad, and I was not even able to move, and I couldn't sleep. So I think that was during the daytime, I would say the mental trauma was worse, but during the nighttime, my physical symptoms were the worst, I guess.
And in terms of treatment as an outpatient, what were you using? I know there's, you know, we don't recommend using NSAIDs, you know, ibuprofen, and I mean, I've heard this pain symptom being really debilitating. How were you treated? What can you share with us?
So I did speak to my primary care. I spoke to ID here, you know, what are the recommendations and everything. And everybody said the same thing, unless and until you have shortness of breath or your SATs are dropping, don't come to the ER. And so I was monitoring my vitals Q2 hours, you know, blood pressure, temperature, heart rate, and pulse ox every 2 hours. So whenever I was getting tachycardic, I was just trying to drink more and more fluids, you know, with electrolytes like Gatorade or anything like that, Powerade. The treatment-wise, I would say I was taking just Tylenol because I was so scared of taking Motrin because of all those, you know, articles and all. I don't know if, you know, how, strong those articles are, but, you know, since everybody kind of scared me, like, don't take Motrin, you know, the symptoms are going to get worse. So I just took Tylenol like at least 3 to 4 times a day, but it didn't really help me a lot. I think one thing which really helped me was fluids, like Powerade or lemonade or Gatorade, I think, and coconut water, and Tylenol as needed. I think that's all I did. But I had some kind of sinus symptoms as well, sinusitis symptoms as well. So since everybody was in the New York City, we're trying a combination of hydroxychloroquine and azithromycin. I was like, you know what? Let me try azithro and see, if it really gonna help me or not. So I did. I tried, 5-day course of azithromycin, Z-Pak, but I don't think it really helped me a lot. So that's the only thing I did.
Mhm.
And there was one point I was very close to going to the ER, but I
Mhm.
was like, you know what? Maybe I'll wait. Let me check. Let me keep a track on my vitals if I really have to go in. But
Mhm.
thank God it didn't happen.
And I know there is some data about the immune boosting properties of vitamin C, zinc. Did you take any of that? Vitamin D? Anything that helped? You think
I
so?
mean, I know everybody were talking about vitamin C, so I got the vitamin C. I was drinking it, once or twice a day. But I'm not really sure if it really helped me or not. Maybe it was like just the fluid intake.
Hmm.
But I'm not really sure if anything really worked.
Okay. Thank you so much.
And in terms of, the other thing that comes up is you are living in a household and you have to quarantine yourself and the rest of the family. In your case, also, was your family already exposed for several days to you at the
Uh,
you were diagnosed, or?
so I'm just gonna go back a little. So I was on pediatric consults that month in March. So I was going to the pediatric ICU, on the floor, and there were a lot of residents and fellows and attendings who got positive, tested positive. So my symptoms started on Sunday evening, and that same night I quarantined myself because I was checking my temperature. It went up to 101.5. I was absolutely okay until that evening, and all of a sudden my fever started. And I was kind of, contemplating, whether I should quarantine myself or not. But I have two kids at home, and my wife, I didn't want to expose him. So I was like, you know what, it's better for me to quarantine myself. But I called my occupational health the next day, and I got actually tested the same day on Monday, and the results came out on Tuesday. But I already started, isolated myself. I was locked in my bedroom, which had an attached bathroom, so that I don't have to come out of the my room. And my wife would just leave the food by the door, and I would say, just go away. I don't want you to get exposed.
Mhm.
And I would just pick up the food and bring it inside. So, and I guess my wife and my kids were, I'm sure they might have been exposed, but they did not really show any kind of symptoms. Even though my wife did complain of some mild muscle pain, and my son had a poor appetite, but it wasn't that serious. So, we kind of, the entire family, we kind of isolated ourselves for 2 weeks, but they did not, luckily, they didn't have any symptoms.
So now that you have recovered, have you had repeat PCR testing or antibody testing to come out of the quarantine?
Yes. So what happened was, in New York, we had a, where I live, Westchester County, we had a clear-cut criteria, especially for healthcare professionals, when you can get out. So at that time, the criteria was, you have to be for healthcare. So for regular people, it was different. For healthcare professionals, it was different, because we are the frontline people, and they want healthcare professionals to work. So for healthcare professionals at that time, and that's like first week of April, the criteria here was 3 days of being asymptomatic. So basically, 3 days of afebrile and 3 days of being asymptomatic. So that's when I came out. But I was
Mhm.
very scared when I actually came out. I was wearing mask, and the moment I came out of the room, the first thing my 3.5-year-old son did was pulled my mask and threw it away. And he said that I don't want you to wear this ever again.
Mhm.
Can,
So
can I?
now you're doing well. I understand you are being tested for donation of plasma, convalescent plasma. Can you
Right.
tell us? How did you
Yeah,
go about
sorry, I digress a little. So antibody testing. So what happened was I came out on April 6th. But last week, Department of Health, our county Department of Health called me and they asked me to come and donate blood, I mean, to give sample because they were checking for antibodies. So it was just the initial phase. So I did it last Thursday, and actually the next day, my hospital actually called me and they were also starting to check for antibodies in all the physician, all the healthcare workers. So they are doing a qualitative test right now. It's not quantitative. They're just looking for IgGs. But here in New York, they are not doing a repeat COVID testing
it?
because they are saying that once you're asymptomatic, that's it. We are not going to repeat and see if you're positive or negative, because I know of people, like my friends who are in different states, have been calling me and asking me what's being done in New York. In New York, that's not the case. In New York is just they're going to just look they're going to look for antibodies because there are so many cases here. They kind of assume that kind of everybody was kind of exposed to it. So they're going to just do antibody testing here. They're not going to repeat. If somebody was tested COVID positive, they're not repeating it to see if they are negative or not, like in other states.
So you have you filled out the form for plasma donation? Or
I did. So
okay.
I did. Oh, it's pretty tough actually. Actually, I put on a post on Facebook after which I would say there were like so many families from all across the country. They contacted me, they called me, and they didn't know what to do about it. Because their father, their mother, their aunt, somebody's in ICU intubated and looking for plasma, and if it's out of state, they don't know because the hospital, not every community hospital is authorized to do the plasma infusion. So they have to, either get it from somewhere else or they have to transfer the patient to a different hospital.
Right.
So it's so tough. The patient is intubated to transfer just for plasma, a transfusion, which is still experimental as of now. It's a huge challenge for the families. So I filled up those forms. So I did fill up forms because especially in New York, Northwell is doing it, Mount Sinai is doing it. We have a local New York Blood Center, which is like the biggest one, is doing it, and also American Red Cross. So
Right.
I did fill up those forms. So even after I filled up those forms, they took like a week to call me or contact me. So just imagine, if it's gonna just take a week for them to call me, again they have to set up an appointment,
Right.
and it's just gonna delay the time period. If somebody's in really need and if this thing is really working,
Mhm.
it's just gonna delay, and more and more people are gonna suffer. And I think that's a huge challenge as of now. This is like I'm telling you on my personal level, this is what I have faced. And there's another challenge is I don't know if it's with every center. They are saying that today, I mean, not today, yeah, today I got a call from New York Blood Center, and they are not taking plasma from people who have traveled in the last 12 months out of the country.
That's so I was reading up on the Red Cross blood
Mhm.
donation, plasma donation for COVID positive patients, and they have their whole guidelines. Like you said, first of all, you have to have a diagnosis of COVID, and you have to have either recovered in terms of you're greater than 28 days of your onset of sickness, or maybe when you were diagnosed, or you've had negative PCR testing. And the third thing they do need for the plasma donation is sort of a quantitative testing. But because that quantitative testing is not available, I understand from reading is they will take the plasma if you meet the other two criteria, because for the treatment purposes, the titer has to be at least 1:160 for the antibodies. Now, whose antibody titer is higher or lower, we don't know, right?
Yeah.
So I think they are just collecting it and then testing the titer later on. before they're sending off for donation. That's what my understanding is.
That's
Uh,
true. That's true because I got the report from Department of Health today. So
mhm,
the report said that they just looked at the qualitative, they looked for IgG. They didn't
mhm.
look for IgM, and they are going to send the sample for further testing to look at for the quantitative level as well. But it's going to take time. So like the New York Blood Center, like American Red Cross, I just want to add something. They also say that you have to be asymptomatic 14 days after the negative test.
Mm.
If you don't have the repeat
Yeah.
COVID, it has to be 28 days from the last year of asymptomatic. So that's what they say. So but American Red Cross actually called me last week itself, and they actually scheduled an appointment end of this month.
Dr. Mohammed, can I quickly ask two questions? Because I have one or two people who are actually not physicians, but they are COVID survivors, and they are here with us in the panel, in the audience. So, and one of them did ask me this question. Initially, there was no COVID testing done. The PCR testing was not done, but they had traveled through Hong Kong or whatever, and the whole family was, probably had COVID like symptoms, even the kids, everybody. And they want to know how to move forward with the donation part. And this was in January, February. Right now, can you go back and tell me? So, did you volunteer to start on the, give the convalescent plasma, or somebody contacted you? That the Red Cross, or how do they even know who's positive, who's not? What is their basis?
So it's both. So I was when I got better, and actually it's when I heard that after they checked for antibodies, that they found antibodies. I started my own process. I went on all the website. You can go on either you can look at Mount Sinai COVID plasma, just Google it, or Northwell or American Red Cross plasma donation. You can go on these, especially these three websites. Most commonly is American Red Cross, because Mount Sinai and Northwell is in New York, but American Red Cross is almost everywhere. So go on the website, fill up the information, and leave your phone number and your email. And there's like a questionnaire. It will ask you your name, when did your symptoms started, when did you were tested, when was the last day you were symptomatic, and where you tested again for COVID or not. And there's like few other details, date of birth, blah blah blah. You just fill it up and they will reach out to you. And that's how American Red Cross called me actually last week.
So if the testing was never done, or was done, the PCR testing was done after the patient recovered, which is most of the time the situation, at least in California, where there was a time when nobody was getting tested. Everybody was just quarantined at home. How are we, like, and I believe 80% of people had been infected. So we have more donors, we just don't know where to start. How are we
Exactly. That's a
testing
huge
it?
problem. That's a huge
Like,
problem.
for
Even as a
visual
physician, I didn't know what to do. So, like I said, American Red Cross, I think, is the best place to start with, if you're in a different state. But if you're in New York, you can either reach out to Mount Sinai or American Red Cross.
Okay.
Just fill up the form. You don't have to call them, they will call you if
Okay.
you meet the criteria.
And so that is for all over the US, like that would be
Yes.
valid even for California.
Yeah. And actually, I live in New York. They gave me an appointment like 3.5 hours away. I mean, the place in Princeton, in New Jersey, is like 3.5 hours. That's the closest place right now.
Okay.
So
And
they might have to travel a little.
yeah, did you already donate your plasma, and what
Not
is your
yet.
blood group type? Sorry if I may ask.
A positive. I'm sorry. I'm A positive.
Positive. So there is a lot of data, right? The AA or B or AB are actually severely infected compared to, and males are severely infected because, for whatever reasons there it is. And even in a family cohorts, there is a lot of data coming out that A or B or AB are more infected and severely infected with COVID compared to O or, O group. So, and I think you will be AB is a universal donor for plasma, right? Nidhi, correct me if
It's a
I'm wrong.
recipient. AB is a recipient.
Oh, so you
O is
are
a
not
donor.
be able to. So no, for blood it's different, and for
Plasma, it might be different.
plasma it's
Okay.
different, right? So I
Okay. You
think
guys
it's
know
the other
better.
way. You can probably give to everybody, right?
Hmm.
AB is
I'm
a
be positive.
universal
I'm not
donor for
sure.
plasma. That's what. Let me just look into that,
I
because
have to go back
that
to my
would definitely
physiology.
be something that where if you can donate everywhere, it's easier. If you can just receive, then there's no point. You will have to choose the patients you can help, right? Sorry, Nidhi, take it over, and I'll get back to this
Uh,
point.
Well, I think we covered a lot of real life challenges and experiences with our panelists today. What I am learning and I'm gathering is, we are so busy living our day to day life, just taking care of patients and family. When we come back home, we have really, a lot of us really haven't taken the time to put a sort of a plan in place, which might be important at this point, as there's talks going out about lifting the isolation at in stepwise manner. And I think it is like, for some of us, we might not even know if one of us is infected at home, and if me myself as a healthcare worker is infected, is the rest of the family prepared for it? Can they be self-sufficient for 2-3 weeks? And what are the things that I need? So I think it's important for everybody to kind of make a checklist of how to prepare yourself when the time actually comes. I think it is very important. And as I'm talking to Dr. Brooke and Dr. Muhammad, I'm realizing that I don't even have a pulse ox at home. Maybe that's something I should uh, get and have it somewhere. I know it might probably not be available even on Amazon, but at least have the order in place. So maybe talking about a little bit of list. And Dr. Muhammad mentioned fluids. He mentioned a lot of electrolyte heavy fluids, and I don't think I have any of those in my home. So, to my audience, I would say that at this point, everybody should, hearing these stories, kind of make a list of how I would deal with this if anyone in my house has to go through, have a conversation, especially with kids. And I welcome both of you to offer any techniques especially for those of us who have kids at home, how to prepare them if.
So I have some not information. It's like a workbook from Columbia. Actually, Columbia just published a workbook on how to manage anxiety in children, especially during this COVID. So
Mhm.
I can actually forward it in the group, the WhatsApp group. I
That
can
would,
just forward it to you guys if you want to just disseminate it or give it to someone. They can use it. It's very good.
it's
So
for what
maybe
age group, may I ask?
so it's usually I don't remember.
Okay.
I have to look it up with what age group. I think it's for children, it's like maybe less than 13.
Okay.
Yeah,
So up to tweens can use that.
yeah,
Okay.
I think so.
So some tips to kind of, I think, do you recommend sort of having a conversation with, is it okay to talk to, kids, tweens and to under, if someone was to get sick and, be isolated or ended up being hospitalized, sort of, is it okay to have that conversation, or is that too, traumatizing for them?
Do you want to go
Dr.
ahead?
Yeah, I'll go ahead. Sure. I am very much a supporter of being honest with our kids. So obviously, based on their age group, the amount that you get into detail is going to be different. Sometimes it's best to ask kids, what are your questions? I mean, I think that amongst different groups, and I know, my daughter is 9, so she's FaceTiming with her friends from school, and if I didn't speak with her about it, other kids are talking about it, and they're saying, I'm scared. This is, and so that's when you say, let's give you the actual facts of what's going on, rather than hearing all kinds of scary things from other kids that may not have the right information. So I think it's okay to tell them this is something that's going on. This is something that, we have to be careful of, and this is why. I mean, you may not get into the very severe nitty gritty, you know, at every age because it's not necessary unless you get to that point. And of course, for us, those were certain things that we did have to discuss. But I think it's okay to explain to them and say, do you have questions? And then you take it from their developmental age of, you know, these are my questions. And then sometimes you say, well, what do you mean by that? And then you take their lead of what they're wanting to know and how they understand more about it. And I think that, you know, each kid at their own developmental understanding of it is going to want to know different things. But I think it's okay to be honest. And I think it's important that we do. A little side note, just, you know, you were saying, what are some things that we can do to prepare, especially with kids? I tried to order from Amazon lots of different activity kits, canvases to paint, rocks to paint, like lots of different things to, you know, keep kids busy when you can't be quite as interactive with them. Another good addition to the Gatorade thing, all I could eat was popsicles. It was a similar kind of electrolyte and fluid thing, but it was easier to tolerate, and you can keep it in the freezer, it doesn't go bad. So those kinds of things are good, and it's a good treat for the kids too.
Thank you so much. Anita, do we have any questions in the chat that you want to bring up?
There was one question, but I think we already answered that. It's what were the medications that one needs to keep at home? And Dr. Mohammed already answered, like, you know, Tylenol, vitamin C, Gatorade. I added vitamin D, zinc, pulse ox, thermometer, which is not
a thermometer.
Make sure that we had that. Both of us had similar experience. Actually, most of the physicians, they don't keep these things at home just because we think we'll get it somewhere or the other. We will not need it. I don't know. If I faced it in my home, and I think Dr. Wingarden also told me she faced it in her situation as well. We didn't have pulse ox, we didn't have a thermometer. So keep those things handy. It's very important. Just order, even if it comes in 1 week, 2 weeks, at least you have something available. So that's something I can say. Any other questions? Anybody can, everybody can unmute and just, you know, ask any question. I'm going to unmute everybody. If anybody has a question, please do ask. Thank you so much, guys. I think that this went very well. Janani, I see you there. If you have any question?
Oh,
I caught you. Supriya, I see you. How are you doing? If you guys have any questions.
Good, Anita, how are you?
Yeah, good. I see Dr. Sham also here. How are you doing, Dr. Sham? If anybody has any question, please kindly ask. You know, Dr. Wingarden and Dr. Mohammed has given his time, and you know, this was such a wonderful session.
I was just curious. Yeah, hi, Anita. I was just curious if any of the survivors had anosmia, but did they notice any anosmia during the initial stages?
Yeah, I did. Not initially, actually during I experienced it.
Did it last longer, or was it over?
It did actually. After all my symptoms were gone, it lasted for at least 10 days. Like me, yeah.
Like I think now my sister, who is in UK in London, she also had COVID, but at that, for them, it's just starting, and she still has anosmia, but she's like, oh no, it's just flu. And like after she has gone through it, so I think the difference between flu and COVID very commonly that we are seeing is prolonged anosmia even after you have recovered from all the symptoms. That's not typical with flu, and time will tell. But yeah, that's one of the very you know, typical symptoms of COVID. Thank you so much, Dr. Sham, for asking that question. What about you, Dr. Wingarden? Did you had anosmia symptoms?
I did not. I had like a metallic taste in my mouth that I still like occasionally will get. My mom had the anosmia. She still has struggles like tasting things. And my aunt and uncle, who also shared the love from my mother's, you know, germs, they also both had the anosmia, and they had inability to taste as well, which did last beyond their other symptoms.
Wow. And if I may ask, what is your blood group and your mom's blood group? Because
we're both A positive.
Oh wow, okay. And would you say your mom was sicker than you, or because she went in ICU? Any other?
She was not vented, but she did. she did get to the low 80s. She probably was pretty close. And she was definitely sicker than I was. I didn't need to be in the hospital. I was afraid, and I felt quite terrible, but she was in a much different place. She had a very, unusual, she was in the hospital. They had to isolate her in her room, and, was texting me all night long about the experience she was having, but she was quite sick. And I don't know, she had some comorbid medical issues as well. So I'm sure that played into that as well.
Sure. Thank you so much. I think that's good enough. Anybody else has any questions? Otherwise, we'll call it a day. Nidhi, what do you think?
I wanted to actually thank
I have a question.
the people who participated. One quick question. What about GI symptoms? Was there significant nausea or abdominal pain or diarrhea associated with this?
I did not have any GI symptoms, but some of my colleagues and my friends who were tested positive, they had diarrhea. They had bad GI symptoms.
And did that precede the other symptoms, the GI symptoms? Do you know? Because
I'm not sure.
You're not sure, because we're reading a lot of reports that these were from China. I'm still waiting for further case reports from US, but in some healthy young adults, it does start with a GI type of illness and then later on subsequently. So I'm trying to place where the GI symptoms, are in the spectrum of this illness. Are they initially, or do they come in the middle, or they come later? But we don't know. I guess we will wait and see. Yes, Doctor.
Sure. I actually started with the fever, and then a few days later, I had pretty severe nausea that lasted for quite some time, but no other GI symptoms besides that.
Interesting. Divakar, do you have a question?
Yeah, I was going to ask, I think there was a previous question about what's anosmia, and for a layman like me, that doesn't mean anything. Can somebody please
Unable to
explain
smell.
what that is?
I just put that. Yeah, sorry.
What does
We
that
can
mean?
explain. Unable to smell anything, like if you cannot smell.
Okay.
Yeah, this is a very typical, and more data is coming out that, anosmia and ageusia, which is unable to taste, or metallic taste, what Dr. Vin Garden just said, it is very commonly seen, and it can prolong very long, even after all the symptoms are resolved. So that's not very typical of flu. So another way to kind of diagnose this. Thank you. Not diagnosed, but
I have a question.
Yes.
I have a question. I'm not sure if it's already been answered. So with the hypoxia, do any of you recommend, people talking about downloading an app and checking your oxygen level at home? Do any of you recommend that? I'm not sure if this was already discussed. I had to step out for a while.
Yeah, not in this.
So for asking that question, both Dr. Weingarten and Dr. Muhammad, I think, mentioned monitoring their pulse ox and vital signs very frequently. But your question specific about how to monitor the pulse ox, using an app versus getting a pulse ox, because my understanding is there's not a very reliable FDA approved pulse ox out there that we can just go and get. So I welcome the panelists to share their experience.
So I will add, because I was at a point where I was desperate to get oxygen levels checked in for my husband. And that's where I started trying to find the app. There's an iPhone app that says you can check, but if you see its rating, it's very low. And I went over a lot of, data that it's not the best that you can have. But if you don't have anything, it's better than, going to the hospital to get an oxygen level checked. And I think it needs some kind of tool as well from Amazon, like a swab or something like that. I don't remember exactly, but I did order
the portable one, the little portable one. Just get a portable one from any,
yeah,
store.
but it takes 2 weeks for that portable one to. I ordered it. I got it after 2 weeks. So if you're really in emergency, it's better than going to the hospital. Yeah, get the app downloaded, see what it might be simpler. It may give you some assessment. Like I was using kids thermometer, though it's not accurate, at least it will give me something rather than nothing. So sometimes we have to make with what we have. So,
right.
Yeah. I think that should be it. Nidhi, you want to call it a day?
Yeah, absolutely. Thank you so much, both of you, for joining us today, sharing your experience and
No
Wish you the
problem.
very best, you know,
Thank you.
returning back to work.
Thank
And
you.
wish you the best with the antibody testing, and, you know, take
Stay
care.
Thank you.
Have a good
Thank
day.
you.
Stay safe, guys.
Thank you so much, guys. Really appreciate all your time.
No
Thank you.
problem. Bye.